We're going to move right into our next session of Bring, Brag, and Borrow. This next topic, don't worry, we'll take a break after this. Our next topic is systems building, connecting caregivers to services and providers to improve access. And first on the list is Catherine Steele-Watson, and she is from Arizona. This is the correct agent, the Arizona Caregiver Coalition.
Thank you, Jill. I am actually from Arizona. If you want to see my driver's license, I have it. So my name is Catherine Steele-Watson, and I am the Program Development Coordinator with the Arizona Caregiver Coalition. And I am also going to be representing the Division of Aging and Adult Services because Lita wasn't able to get in until later this afternoon. So I am both. Please don't judge me because I am more professional in one area. I'm not so sure in the other one. So before we get started, I did want to give some updates about Arizona Caregiver Coalition specifically. So as we've all been talking about vouchers, we actually recently extended our voucher option as well. So we were doing $5.99 before, which we kind of covered over about 6 months of the self-directed respite for family caregivers, but we have extended it to the $1,200 option as well. So we had some caregivers who were previously enrolled in the $5.99 option. They used all of their funds and we asked them to extend. They were kind of our little focus group to start with first, and then we had it open out to the public for all caregivers to apply for. We don't ask for income. We just have a little check sheet of, are you receiving services through X, Y, and Z? And if they say no, they qualify for our program. And with that, we do ask that the family caregivers complete a W-9 and send it back to us, and then we give them a 1099 at the end of the year. We've already had 10 people enrolled in our program, and we just started it in July, so very exciting that we're kind of getting some traction on that. We are also in the process of developing a resource page. So Arizona Caregiver Coalition, we're a nonprofit that we kind of contract with the government entities in Arizona, but we are more of a resource center. So we have a resource line that caregivers can call, and we give them information not just about our programs, but all the programs that are available in Arizona. And we are in the process of making a resource page. We do have an AmeriCorps member who's working on that, and we are going to have it where it's searchable. So a family caregiver can say, I'm caring for someone with Alzheimer's and dementia, and then there'll be the resources in Arizona for that individual, or I'm caring for a child with disability, so on and so forth. So that we are hoping to get done by June of 2023. So fingers crossed for that, maybe by the end of this year, depending how things go. And then I also wanted to talk about the Arizona Respite Network. So this is a network that meets on a quarterly basis, and this is made up of my organization, the Arizona Caregiver Coalition, also other government entities such as the Division of Aging and Adult Services. We also have the Division of Developmental Disabilities and other nonprofits and private organizations that are involved in this network. And we meet to talk about discussing language and messaging surrounding caregiving and trying to reduce the stigma of caregiving, transportation issues, services for Alzheimer's and dementia, or Division of Developmental Disabilities. And with that, we have also begun creating the respite provider list. So if we could go to the next slide, please. So with this provider list, this is also going to be available on the Arizona Caregiver Coalition website, and it is a list of all providers, so it's like day centers or in-home care providers, HCBS, that are all contracted with the area agencies on aging. This list is also going to be searchable, so by region or by type of care that a caregiver is looking for, that would be posted on our website. And this is part of the Arizona Respite Network, a project that we have been working on. And we currently have all of the lists of the agencies that are contracted with the area agencies on aging, and we are working to make that into a searchable list on our website. And since they are contracted with the area agencies on aging, all of these providers do have to meet those qualifications, so that way any caregiver can have that comfort knowing that these are qualified, verified, and inspected providers. And if we could go to the next slide, please. So I also wanted to talk about the program impact and some stories from our family caregivers. So I have a few quotes here, so I'm sorry, I'm going to have to read right from my page. So we do have one caregiver specifically that I wanted to highlight. Her name is Mary, and she is from the Central Phoenix area. And she had a mother who had late-stage Alzheimer's and dementia. Mary had to leave her job. As most of us know, a lot of family caregivers end up having to leave their jobs, and she was very much struggling financially. At one point, she only had $20 in her bank account. So she felt the stress of that nonstop caregiving, 24/7 caregiving for her mom, and she enrolled in our actual adult day health center program, which is a little separate from the voucher program. But she said that she got back precious time to take care of herself, to run errands, and know that her mother was being well cared for at one of these licensed facilities. We also had Jean K from Phoenix, who said she didn't know she needed respite until she had it. Now, how many of us have heard that from our caregivers, right? Yes, exactly. So that is one big thing that we're also working on, is helping family caregivers identify as family caregivers and reducing that stigma around caregiving, and also educating caregivers on the resources that are available to them in Arizona. But with that, thank you all so much for letting me come up and talk for a few minutes about our program, and let me know if you have any questions.
Thank you, Catherine. Sarah from Idaho.
Thank you. And I love that Arizona program is housed under the Department of Economic Security or Development. That's brilliant. I love that. I mean, what a foundation for social service programming, to be thinking about this is the right thing to do for health and well-being in the big picture. So I'd love to learn more about how that was maneuvered. I like that. It sounds like that's got a lifespan focus to it too, which is really nice. So thanks. I'll let you put the slides up for me. So here with the Idaho Caregiver Alliance, we are a group of about 1,500 individuals across the state of Idaho. And Idaho is kind of one of those curiously shaped states. We're really long, really remote, and so COVID has actually been a huge asset for us, because we hold quarterly meetings, and pre-COVID, we'd hold them in Boise, and we'd have about 35 to 50 people come. Now we hold them via Zoom, and we have people across the state joining us for our quarterly meetings. So it's been a really cool kind of capitalizing on need to create this reach. We have a strong focus on lifespan. So Idaho Parents Unlimited, our independent living centers, our area agencies on aging. We work really hard to assure that we are looking like we are lifespan and not just older adults. Our funding comes through the Commission on Aging in Idaho, which is wonderful and great, through the Lifespan Respite initiatives through ARCH and ACL, but work really hard to have that lifespan perspective. What I'm here to share a little bit about is our outreach efforts. And getting the word out is constant, as I'm sure all of you know, about how to reach family caregivers. The Caregiver Alliance, we are a convener, a catalyst, and really we're a test kitchen. We do not deliver services currently through the Idaho Caregiver Alliance. We are the entity that brings people together to share voice, to share experience, and to connect. But we are a test kitchen. And what I'm sharing today is our test kitchen of the Family Caregiver Navigator Program, which is funded through our Division of Medicaid through residual dollars they had through Money Follows Person. So our Money Follows Person program recognizes that if you don't have community-based supports for individuals moving out of institutional care, they're going to be right back into institutional care. So we have, we're in our third year of a grant for the Family Caregiver Navigator, which is, we're using the evidence-based platform TCare to deliver this program. I think New York is also exploring TCare. So we are busily piloting this program for the state of Idaho to see how it works and whether it's sticky for us. So with that, though, we have found the challenge, again, of kind of getting the word out about the program. I love the county-based kind of connectors that someone shared today, the advocates, the ambassadors. What a cool way to do this. Where we have really been working with our advocacy and connections is with healthcare providers. We believe that a family caregiver is much more likely to take action if they get a nudge from a trusted individual in their lives, from a physician. in particular. So we have been working diligently to fold our Family Caregiver Navigator program into the healthcare system workflow. But it's been an uphill battle. But I'll let you go to the next slide here. I think I have a couple of examples of some of the work that we've done with this. We've developed short videos describing the program. We're also offering all of our materials in both English and Spanish, wanting to reach out to our Hispanic population. We have come to recognize, though, that the need for cultural sensitivity in delivering a program is huge, and not sure if T-Care in its current iteration is as appropriate for a Hispanic culture as it is for a white culture. For example, one of the primary outcomes of T-Care or measures is the likelihood to place in an institution. Well, that's not really a variable in most Hispanic families. They're not thinking, that's not on their radar. And so what we're thinking about is, what about an outcome? Is this support allowing you to maintain your employment? So thinking about it more broadly in this kind of public health, social determinants of health piece of a framework around this. And again, that's why I love that Department of Economic Development. I mean, that is the picture here, is this keeps businesses alive, this keeps families at their jobs, but looking at a system that allows that nuance for fitting with the cultural norms of the population you're working with is a good challenge. So part of our outreach has been through these videos. And then I'll let you go to the next slide. I won't show these videos. We've also looked at testimonial videos. So we have testimonials from caregivers of their experience of working with the caregiver navigator. And our navigator, again, they do an assessment process, and then there is a text messaging built into the T-Care platform, which is fabulous. The caregiver gets a little nudge, just checking in. And then there's a 3-month and a 6-month follow-up. So we have longitudinal data of impact. And I'm so excited to hear that ACL is building in outcomes into the next round of grants. I think it's essential that we begin to measure our value, because nobody else is going to care about it if we can't tell the story. So we have a couple of testimonial videos that we've developed, and then I'll let you go to the next slide. Again, speaking to our outreach to healthcare providers, we've developed these simple little RX pads for our referring partners. We do a thank you follow-up to our referring partners. I brought one of these with me. If anybody wants to tear off a page, you're welcome to look at our RX. We borrowed this from out of Canada, but I'm sure all of you guys have done this as well. But one of the pieces that we've put together, and I don't remember if I have another slide or not. Oh, yeah, and here's our funders. But we've also done some brochures. One of the pieces that our funding from Money Follows Person has allowed us to do is hire a communications person. I cannot speak to the value of that individual. You know, first day on the job, they were doing research to develop these kind of caricatures of what a caregiver is across the lifespan. They developed that frame, and then they've developed materials built on that frame. Like a millennial caregiver, they don't want a piece of printed paper. They don't even have a printer in their home. They want it online. You know, an older so it was just such a brilliant kind of like duh moment for me of, we got to have communications and marketing on board, and you got to fund it. And that's the way I think that we get this lift as well, is really recognizing we need the whole team on our kind of administrative pieces as well as we move this forward. But that's a little bit of the bring, brag, and borrow or steal, whatever we're doing here. But thank you.
Now we're moving into our Lifespan Respite Grant highlights, and I put people in this category because they had so many things they wanted to talk about, they couldn't pick just one.
I'll go fast. It's all important. It's just too important. But first I want to say to Meg Pooch for being just a wonderful partner in this Lifespan Grant. It's, I just feel like Illinois is just really making some headway, and thank you for all you do. And I'm really blessed too that we have our board president with us, Maggie, and our staff here too, Lexi. So I wanted to make sure. So the training opportunity, you heard a little bit about it, but this pilot project, I can't say enough about RCAW and, boy, I hate seeing myself. Do we have the slide back? I always think I look better than I really do. So through this training, here's just some stats. So 88 individuals have been registered, and I think that was to the middle of August. And we didn't get the training Illinois specific until the end of January. We are also right now working on making it accessible, and we're about halfway through having this training also in Spanish. By even having this project, we've created so many new partnerships. We've had so many other agencies contact us and say, can you adapt it a little bit? Is there any way that we could have our workers use that? And through our respite provider quarterly meetings, we've had now some agencies going to start to use this training. It's all offered for free, and then you get a certificate at the end of the training. That's our flyer, and then there's also a link that goes with it. What did I want to say? We also give a $50 stipend to the first 100 who complete it. And then our goal is really going to be to work on this registry and really try to help some of those caregivers find somebody who's trained. And then again, with our state partner and the promoting of this program that they've done statewide has been wonderful. Next slide.
Is that the right one?
Yeah, that would have that. All right. So just a little bit too about the programs and the resources that we offer. So through the Lifespan Respite Grant, we just started that 866 Illinois RESP number, and that we got started pretty quickly in August. And just to give you an idea, in the fourth quarter alone, we got 1,100 calls. So, really trying to have that connection, one place, one number to call. Feel like we're getting there. The emergency respite, so we received funding in January. So from January to June, 104 caregivers received emergency respite, and we do a $500 voucher. We did receive over 384 applications. And some of the data from the surveys, 54% of the individuals served made less than $25,000 per year. 47% of the caregivers served identified as Black or Brown, 23 identified as Hispanic or Latinx, and then 8 Asian, and then we had 20 Caucasian and 2 did not identify. We are also really fortunate to have a in-home and a voucher program, and that's through the IDHS DD funding. And the in-home is statewide except for Cook, so that's serving 101 counties. I think there's 102. And then the voucher, we're really serving just the central and southern Illinois. Virtual programming, this is something really learned from COVID. So we've had a synchronous programming added, and it's added by category. And I don't have my piece of paper that has all that, but it's color-coded and it's across the lifespan. And it gives different ideas for activities, exercise, do-it-yourself projects. Synchronized programmings and trainings are going to be added this year. And just this year alone, we've had over 34,000 hits on our website. And those are just some information pieces. Next slide, please. So we did, too, a conversation with caregivers, and that was led by 2 board members, Maggie and Cheryl Smith. And we're going to want to be doing more of that. That was really something that was offered statewide. There's Maggie there, and it was just really nice to have people call in, and both of these board members just opened up and started, I'm just going to tell you my story. And that really led to some really positive outcomes. Caregiver virtual package, we started that December 2020, and it was huge getting the calls and what it meant. So every December we're doing it, and there's the flyer, and then there's all these different links to maybe Oprah's favorite books, to different music, and something for caregivers to try to take care of themselves. We also do a Sunday spotlight, and in the top corner there, that is, that's where our families will just send us information about how what respite means to them. And this one, this family has 3 boys diagnosed with autism, and the grandmother is the respite provider, and she is teaching them how to make bread because she wants them to have a business. And so that was a piece that we had published. We do a lot on social media. This coming year, we're going to be kicking off our lending library. We've already purchased our iPads and our Alexas. We, look to really expand and create an electronic database. With Meg, we're going to be getting this Illinois task force together, Respite Task Force. And then the last piece is this caregiver survey, which I'm really proud because we've taken a lot of time on this talking. And it was really what we're going to be sending this out statewide. We just don't want to ask the same questions. So we called Jill, and she's like, there's a lot of stuff here, Tina, so we're not recreating the wheel. If your state sees some of the same questions, if we are back here next year to share. So we're really looking at trying to find out what specifically do caregivers want? I mean, you're funding in-home, you're funding day programs, you're funding, vouchers. So we're really looking at trying to get information and working with other state agencies on making sure this goes out statewide, and then collaborating with the questions. So thank you very much.
Thank you, Tina. You did a great job. Now we will bring up Doris, who needs no introduction.
Thank you, Jill. So I'm one of the states that had too much to say and said to Jill, I'll talk fast, I promise. So I just want to could you go to the next slide, please? So before I do anything, I want to call out our core team. It's what we've called ourselves since the inception of the Lifespan Respite Grant, which was 12 years ago. I've been the director of the coalition almost 7. But we have an incredibly strong partnership with the New York State Office for Aging. That's Dina and Abby. Anne Marie Cook, who's my boss, the head of Lifespan. Steve, who's our county fiduciary. And Dr. Tom Caprio. I think maybe some of you have heard of Dr. Tom Caprio, but he has been our evaluation consultant since the very beginning of our grant. And I know Jill mentioned the sustainability that we do when I was out of the room, but truly this team has really wrapped around the concept of sustainability. We use the ARCH toolkit, and all of the things that I'm going to share with you, and all of the things that I can share with you in my presentation, feel free to drop by, are because of our sustainability piece. So the next slide, please. And none of them are here, and I'm bummed. So anyway, so the Caregiver Wellness and Respite Center, since we started the sustainability discussion, we had this big dream of kind of a hub and spokes model, right? So here I am in Rochester, New York, and our partners are in Albany, but we wanted to be able to create these satellites of the coalition around the state. So when the last enhancement grant came out, we jumped on it, and decided that we needed to start and pilot this very first satellite. So it covers 6 counties up in the very northern region of our state. It's very rural. We had a grand opening in June, so it's very warm in the summer, but in the winter, it's brutal. Anyway, we decided we needed to partner with somebody who had a real firm footing already in that area. So we went to the ADRC providers. So they have the DOH grant for Alzheimer's up there, but they really had the infrastructure to be able to do this. And so we are piloting. So we've just gone into our second year of that 5-year grant to be able to reach more caregivers, across the lifespan caregivers. We're also using T-Care up there. And so that's just getting rolling, but we expect to get a ton of data out of that, so we're very excited about that. And so that's one of the big things that we're working on. Next slide. Exhale, they are presenting, I think, tomorrow. Exhale is the Ralph C. Wilson Jr. Foundation, the Health Foundation of Western New York, and the Ann Arbor Foundation. And they've come together, and this is their second round of funding. So within the Western New York area and in Michigan, they put out requests for proposals for really unique, out-of-the-box thinking proposals. And we were very fortunate to land that grant. So it's $300,000 for 3 years, and the $100,000 each year. And we're partnering with St. John Fisher College, which is a very community-based oriented kind of college in our area, along with SWAN, which is a community area neighborhood association in the heart of the inner city of Rochester. So we're partnering with them and the Finger Lakes Alzheimer's Caregiver Institute, which is also part of Lifespan. I work for Lifespan. It's different than the Lifespan Respite Grant, but people get really confused when I say Lifespan. But to develop a drop-in center for folks in this very deprived neighborhood of Rochester, using students across all disciplines to develop the program, market the program, and staff the program with oversight from someone from the Finger Lakes Caregiver Institute, and to develop a toolkit that universities can use to replicate this program across the state and or the country, because we think big. So that's an exciting thing for us. And next slide. Lisa, we can't say enough about you and the Respite Registry, but we were fortunate enough to be invited into that pilot as well. We have gone ahead and contracted with Gnosis, who provides the platform for the registry and the training. So we've launched that into New York, but what we're really trying to do is to tie it into all the other initiatives that we have. So we have grant initiatives. We do mini grants. We require using that training or our rest training, depending on the type of respite they're providing. We're hoping to tie it to our voucher program to offer that stipend that Tina was just talking about. If caregivers are using our program, to offer them a stipend to get the people that they're hiring to use the Respite Registry. So that's kind of cool. And we have a couple of other irons in the fire that I really can't say right now, but we're this close. And we're requiring, and in that proposal, it's 300 volunteers to provide respite over 3 years and get them into employment from the volunteer experience, or at least 45% of them. So those are the big things that we're working on, and we're just so excited. And it's always so great to be here. Thanks.
Thank you, Doris. There's a lot to borrow there, I'll tell you. Whew. Next on our list, our last person in this category, Aita from Oklahoma.
Good afternoon. It's like asking to pick your favorite child, right? Like, that's just wrong, Jill. No, I'm kidding. We have an awesome team in Oklahoma, and I gotta say, so many of you, we've been able to work with you, and I don't know about you, but I do feel the love and the commitment, and I appreciate having an in-person conference because it is the labor of love. And I'll say it again and again, We have learned so much from the other state partners, and so I want to say thank you to Jill and thank you to ACL, because honestly, we learned so much, and I know I'm taking notes, and we've got handouts and follow-up. So again, thank you guys. I look forward to hopefully talking to all of you at some point. And I have a timekeeper. Labor of love, right? I could talk. But the slides, please, because I too don't want to see myself on there. And what is it about Wisconsin and my hair? My hair does not look like this usually, and I come to Wisconsin, and I'm like, my hair usually, okay, anyways. Okay, and I left my notes over there, so you guys are in for a treat here. No, the main thing I want to mention, we actually had a statewide family caregiver conference pre-pandemic that was in person. We were strategic about having it located to where as many family caregivers could attend. We now have moved it virtual, obviously because of the pandemic. And we've got to say, as a planning committee, the feedback has been very positive from family caregivers in thanking us, because they have said otherwise they would not be able to attend. And it is a lot of fun. Yes, it's a conference, but it's intentionally planned with them in mind, their unique needs. We have a DJ, which is really great. Like, honestly, guys, if you haven't used a DJ on one of your virtual events, I would highly recommend it. It really does help. We give away gift cards throughout from the beginning to the end, and we truly try to recharge them. I'm a family caregiver myself. Many of you are. We're overwhelmed, we're tired. And to have a day, a conference that's all about them, many of them are like, you know, surprised and shocked, because they're like, thank you for thinking of me. And so again, I highly recommend, and we're happy to meet one-on-one. It does take a team. We start planning it, not right after the other one, but soon after. And again, we do have it in the month of November for the National Family Caregiver Month. So it's a lot of fun. This year we're doing Family Caregivers Are Superheroes. We're doing pre-conference gift boxes that are going to be snail mailed to those that have pre-registered, and it is a lot of fun, and they are recharged. We continually look at updating our website. If you haven't checked it out, please do, okcares.org. We have a searchable directory that we're working on, and we're continually trying to improve, and as well as use, of course, our social media platforms to reach these family caregivers. Because as we're starting to return in person and we're talking to family caregivers, they don't know what other resources are available, and many of them have never heard of respite. How many have you heard like respite, respite, like I heard? Yes, we could probably play a game of how it's been pronounced. So we really do try to have really just terminology, language that they can connect with. Have you had a break? You know, really try to, as a team, communicate that. We work actively, as I said earlier, with other statewide programs. We have an active, engaged respite subcommittee. These are the other statewide programs. That's Veterans Affairs, foster care, adoption, developmental disability services. And so if you think of where you're at in those statewide programs that have respite programs, we have the subcommittee that meets quarterly. And if a caregiver contacts them and they're unable to help them, AAAs too, by the way, are on this subcommittee. It's essentially a no wrong door approach, in that if it's not their program that can help them, perhaps Lifespan can help them. And so we do highly recommend increasing communication with all of those statewide respite programs. And we also have a respite locator on our website. Next slide. And honestly, I'm already running out of time, and I've got 2 more slides. Okay, so just conceptually think of our team located across the state. We are those service navigators. Many of us are family caregivers ourselves. We're having a one-on-one conversation with family caregivers. We're going to match them with the appropriate respite program because we truly are committed that every family caregiver should have a respite plan, should have access to respite. We also have made some changes in response to the pandemic. The main one I wanted to point out is we did lift our income restrictions. We do no longer have household income requirements. And also, the family caregiver can choose someone that resides in their home that's 18 or older, as long as the primary family caregiver is getting a break. And so we have a respite app, respite registry, and please join our breakout session. We're going to have more time to talk about that. And of course, we do a pre and post survey. These are for our family caregivers accessing the Lifespan Respite program. Would love to share more data information with all of you because, again, it is impactful. We get the qualitative data and we have quantitative data to share. Next slide. And this is really something I'm personally passionate about. As I said, I've been blessed to be a family caregiver, and that is our oldest daughter, who's 21, and she has 3 other siblings. They have grown up accessing SIB shops. If you have not heard about SIB shops, I highly recommend doing some research, and again, please come and talk to us. But our siblings need us to really focus on them, and as a program, we've been able to do that. Through SIB shops, as well as we had our first sibling camp. It was an overnight camp back in June, and siblings were able to connect with other siblings who get it, and it really was awesome. And I just want to say and point out a couple of, in their own words, one mom, she was picking up her 3 kids, again, with special needs and without. She said it had been 17 years since her and her husband had had time away. They usually trade off where one maybe gets a break and the other one doesn't, the first time in 17 years. And so the other was from siblings themselves telling us, and you could see it, it was so awesome to be a part of. It was really a dream come true. And I don't know if anyone has ever met Robin Boswell on our team. Years ago, she was here at a conference. Our program is so committed to helping siblings. The data does show the more we can support them, the younger they are, they have a higher likelihood of having a positive relationship with their brother or sister with special needs. And we do not assume they're going to be a family caregiver, but the data shows they will highly likely have an active role in decision making. And again, their needs go unintentionally unmet, especially when their brother or sister has high medical needs. And so I just really encourage us to really look at supporting our siblings across the lifespan. Of course, these projects are geared towards those younger, but we actually have been working on programming for those young adult siblings as well. And those siblings are great about getting us parents to talk about maybe some things that we may not want to talk about. And those are conversations that need to happen. And so I would just encourage us to really think about our siblings as well. I know I'm over, Jill. I'm so sorry.
We love your enthusiasm and passion. I wouldn't give that up for anything. Next, we're moving into needs assessment and survey data, and we have 2 presenters. The first is Sarah Schmidt from Arkansas. Welcome.
Thank you. So I did not prepare slides today, so I pray that you guys will leave that up there and I don't have to look at myself on the screen the entire time. But my first time here at the conference was in 2019, which is the last time we held it in person, and I think I went home with an entire notebook full of ideas of things that we wanted to really do in Arkansas, where we had really been struggling. And for the past year, we kind of shot off like a rocket, doing several things at one time. We started an in-house voucher program. that we used to subgrant out, but now we've brought it in, and we're getting a lot more traction from that. We implemented that back in November of last year and have already given out, I think, about 150 vouchers. So that's going pretty well. We've developed a respite provider registry online that's searchable. And then we've also, we're lucky enough to be included in the respite care pilot training that Wisconsin and Arch put on. So we've been kind of building around our training program as well. One of the things in our first year of our new grant was to kind of get some data and caregiver feedback from our state. And then in our second year, we were going to do a really big outreach campaign and just promote the Lifespan Respite. So last year when we got to start looking at and talking about bringing hopefully a vendor on board to do this survey and feedback, we quickly realized we didn't even know what we wanted to ask. So we kind of had to pull back a little bit, and we thought, okay, let's get some data ourselves first before we go out and gather more specific stuff. So we kind of brought it internal and did what we call a preliminary data report. We simply did it within DHS through a Survey Monkey. So we went through all of all of the toolkits and all of the stuff on Arch, found surveys from AARP on caregivers, and anywhere we could find to just kind of pick and pull questions that we thought might be good, threw them all on a Survey Monkey. And then luckily, because we're DHS, we could pull data of applicants and caregivers and others from any of our Medicaid and non-Medicaid services that we provide in DHS. So we were able to get a really big core group to send this out to. I think we sent it out to over 60,000 people, but we got back response from 553, which was actually more than what we expected. So it actually turned out to be pretty good. And what we learned when we were going through the data was it led us to a lot more questions, for one, but it really gave us a good foundation of where we were as a state. And just so, for example, some of those data points that we had, 67 out of our 75 counties responded, so that was about 89% of our counties. We got a really good overview of the entire state. 65% of the caregivers have an annual household income of less than $30,000. So that was pretty prevalent when we looked at that. And then, of course, the higher in age the caregiver was or the lower the income, the higher the strains became. So we looked at both physical, emotional, and financial. So we looked at all those different strains. We asked how many people had heard of respite, and it was shocking to us that less than 25% had ever even heard of respite in our state. We even asked if they had experienced respite before, and about 7% of them had, which the national percentage is about 14%, so we were way below that. When we asked where they gathered information and got access to things, overwhelmingly it was from their healthcare professionals or their doctors. Many of them, over 50%, said online and social media, and then through their family and friends. So what we're doing now, we just published it last month, but what we're doing with it now is taking this information and building our outreach campaign. So we know we want to hit the healthcare profession. We're in talks with our Department of Health, trying to get it out into all of the doctor's offices across the state. We know which rural areas we need to hit. We're going to do a big online social media push because that was another one of them. And then we're in talks about how we can do something with family and friends, maybe even like a refer a friend to our voucher program. That is still just kind of in the brainstorming ideas, so we don't really have much there. But that's all I got.
Thank you, Sarah. You really have accomplished a lot in the last year or two. And last but not least, Melanie Wright with Texas, and welcome.
Hi, thank you. Sarah, I feel like we're kindred spirits. You're probably gonna hear a lot of the same things coming from Texas that I just heard coming from Arkansas. So I wanted to present today on our initiative to collaborate with the Texas A&M Public Policy Research Institute. Oh no, please no. No. Next slide. I need highlights badly. It's bad. So that's our PPRI partnership. So I will be presenting on that today. Next slide, please. All right, so just a few highlights here, but basically since 2009, the Texas Health and Human Services Commission, HHSC, we've received several Lifespan Respite State Program grants. Most recently, we've been working on expanding and enhancing respite services in Texas by coordination and dissemination of available services in the state, streamlining access to respite programs, filling gaps in services, and improving the overall quality of those services. So to help inform the agency, back in 2020, we contracted with the Public Policy Research Institute, the PPRI, which is a research organization that operates within Texas A&M in College Station, Texas. They have been conducting a multi-stage needs assessment and gap analysis to help us to better understand respite area needs. And based on that needs assessment data, they've been helping us to optimize the data bank of resource material for respite care providers, stakeholders, and we also have a special interest in faith-based organizations as well. One of the big pushes for us was to also have our website evaluated. We had a feeling that it was out of date and it was being underutilized, and we were correct. Well, I'll save that for later, but roughly 90% of Texans didn't even know that we had a respite website, so we've been really working on trying to improve that. So you can see there's some of the questions there that PPRI has been seeking to answer for us and trying to help us. Next slide, please. Great. So regarding the data capture, as part of the needs assessment, PPRI surveyed a little over 1,200 informal caregivers across the state. And similar to what Sarah just mentioned, 25% were not aware of any respite care services or had never even received information about it. And Texas is a big state, so that is a significant portion of the population. So we realized we needed a complete overhaul of the marketing of respite care services. And we also found out, there's all sorts of data points, and I can share these with you separately, but there were some really fascinating pieces of data that came from these surveys. But the average respite care need in our state is between 1 and 10 times a month on average. So there is a huge amount of need and not a lot of care being used to meet where that need is. As I said earlier, about 85%, close to 90% had never visited the Take Time Texas website. So we are starting next year with a comprehensive marketing campaign. So we're going to, I'm glad I'm the last one because now I have all sorts of ideas to borrow for that media campaign. I've loved all of your videos and your testimonials, and I think one of our goals as well is to add some of those features onto our own website along with training modules. So that's something that we have not done in a long time, and we'd like to restart that. Great. Okay. So one of the things that's really cool about our relationship with PPRI is that all the data that's coming from them, all of our outcomes are evidence-based outcomes. So that's a huge piece. We're not just kind of throwing darts and trying to see what works. We decided to kind of take a step back and really go with an evidence-based approach and evidence-informed outcomes as a result. Great. All right, I think I'm just about done. So I could talk about this for hours, but I'll stop soon. So next up, we are going to, PPRI is going to roll out with a formal survey for FORMA. That should say Survey for Formal Respite Care Providers. I apologize. They're also going to be doing some virtual focus groups starting next month. And those will be organized by geographic region. That we have a lot of regions, so I think we're going to have 5 focus groups, and then we're also going to target some specific subpopulations, including the Asian American subpopulation and youth caregivers, and also faith-based caregivers as well. So those are some groups that we're interested in learning more about. And again, we're looking for evidence-formed examples of best practices from other states as well to help us learn to grow. So I think I think that's it. Yeah, I covered our marketing campaign. So we have revamped our Take Time Texas website. We're in the process of testing it before we roll it out, and we're also going to use some of the data that we are able to pull from PPRI to help us with our own respite database. So it sounds like a lot of us are trying to do that. So yeah, so that's what's happening in Texas. Thank y'all, appreciate it.
Thank you. I just want to make sure I didn't miss anybody, did I? Everybody presented and had a chance to share their 5 minutes. Thank you all. That was an amazing day, and my head is exploding with all the amazing things that you all are doing, and there's so much to bring, brag, and borrow as well. So thank you for sharing that. We are scheduled to take a quick break, but before we do, I want to make sure you all have a chance to ask your colleagues any questions right now about anything you heard in this afternoon session. Anybody have any pressing issues they want to raise or connect to someone that you'd like more information about? Everybody wants a break, huh? Let's take a 10-minute break, and when we come back, we'll be concluding with the ARCH update and then a quick interactive activity for you.